you're recommending. That's the direction the CCOs are moving in. And I would just add, just engage in your community, whether it's a neighborhood association or, city boards and commissions, county boards or commissions, state boards or commissions. And for Oregon Health Authority, you can get on our website. It's, we're trying to be really transparent with this whole CCO, health systems transformation. So it's, www.oregon.gov, and then /OHA, /OEI if you want to get to the Office of Equity and Inclusion information too. But the Oregon Health Policy Board has regular meetings, and those minutes, those agendas are posted. There's typically, public comment time on the agenda, and so, really, watch us and get involved, and share your stories when it's related. Which it sounds like there's a lot of great stories.
We saw
here.
one today, a story, and I assume you're going to take that back to Providence and see.
I am. We're going to talk afterwards. So,
what else? What did you guys think of that people might be able to do if they're so moved to encourage better health access?
Well, doctors work so hard. At the education level, they pay so much money to go to school. It is not an easy job. How about the education system look at ways of giving incentives, educational incentives? Mm-hmm. I know there are programs there are forgiveness programs. If you spend so much money going to medical school, you definitely you have a good heart. That's why you went to medical school in the first place. So give the doctors a low break with their tuition. Do something to show appreciation.
Well, not only that, but we're talking about the cost of health insurance, and you guys said the uninsured. But I have a really good friend who is a doctor, and she had to stop doing surgeries because the malpractice insurance was so expensive that it was taking about half of her salary. So now she just does second looks and so forth. But costs like that are adding to this as well that I think should be looked at.
Other things, other ideas. Charlie?
I mean, I think so it's definitely educate, empower, engage, and I think for the purpose of this conversation, I'll say empathize. I think education in the sense of just know what's going on around you. Get connected. No matter what county you're in, there's some conversation going on about the health transformation, the Oregon Health Authorities happening, knowing what laws are being passed that affect health, the school board meetings. 'Cause nothing we do in operating, we work in silos. Everything connects, there's intersect. I think empower, part of it is just really knowing what your rights are and how do you advocate for yourself or your family member, your neighbor as they navigate the healthcare system or even just the social net setting. I'll say engage in terms of, really, using your voice and your experience to help change some injustice or some barrier that you encounter. And I think engage even in the sense of also communicating, when something goes right. Because I think oftentimes, especially for doctors or people, the care providers, it's always when something goes wrong when you hear from people. If you had a positive experience with a doctor, I think, share that. And I think empathize in terms of, definitely with the changing demographics that we're in, we cannot control it's happening. And I think part of it is really putting ourselves in that person's shoe, no matter how different the life is, and really seeing how can you use your power, your privilege, your influence, despite where you may stand in society to really help make life better for yourself and those coming behind you.
Margaret.
I guess I'm going to add to your another E, and that would be around expectations. So I think
So let's review. We have education.
Educate, empower, engage, empathize.
Educate, empower, engage, and
empathize, and now
empathize and
expectations.
expectations.
So I think being informed, but I think, we are a medical system and society of great technology. And what we see a lot of times is some patients want everything. And that may not always be possible in a system where we're trying to share all of the resources. So having reasonable expectations related to the resources that are available, I think is going to be really important.
Let's skip down to this end, Ramin.
Yeah, I think it's very challenging. I think there's a lot of different ways that someone can contribute. It seems like I was reviewing before this panel the Coalition of Community Health Clinics, and it just seems like there are a number of opportunities for getting involved with those, which are a great safety net outside of the ERs for Portland. And so it seems like if a person were interested in contributing to healthcare access, finding ways to help one of those clinics, learn about those clinics, for the more motivated, maybe even figure out how did this clinic start in the first place, and then think about, are there ways that we can add to the access? Because when you look at the website for some of these clinics, not all of them are taking new patients. Many are not. I mean, they prioritize people, but often there's just not the care providers for people. So for me, I would love to be able to have a sheet to say, call this number when you leave the emergency department. You will absolutely be able to get a primary care provider who will see you in the next 2 days, right? So if I had that, that would make my job very, very easy.
I don't know.
I just want to point out, this is the discussion here at Marylandhurst next week about community clinics in particular, if you want to start there. Go ahead.
I don't know if you're familiar with Project Access now. So Project Access is a regional nonprofit that exists to coordinate, to do more specialty care for the uninsured population. And they have a great partnership with all of the health systems on where, so say for instance, someone comes into one of the clinics and they're uninsured, and the doctor identified maybe this person might have cancer or needs some sort of surgery. So Project Access job is to coordinate the care for that individual and get them whatever specialty care, whatever additional support that they might need. Part of the resources are there, right? Part it's I think it's like access. It's.
Maria and Patrick, wanted to hear from both of you before we wrapped up tonight about what people might do if they want to affect better change.
Well, I am going to advocate for my patients because they obviously have a special place in my heart. So I would recommend getting involved, donating to the National Association for Mental Illness, NAMI. I don't know if people are aware of that, but it is the largest organization that advocates for access to treatment, support, and services for people who struggle with mental illness. And I think we all are on a continuum of mental illness. So part of it is staying well and increasing awareness about mental health. And NAMI is a way to do it, and the walk is May 20th down at the East Esplanade. So people can join us and walk and support our team, support our patients, and support all people by being aware of NAMI. They just do wonderful things, and it is free to patients. They do a lot of peer-to-peer counseling, provide education, brochures, and we host NAMI representatives at our hospital to speak with our patients so that we can connect them in the community. So once they discharge, they have somewhere to go. So I would say that would be one way of increasing awareness.
Patrick?
I actually was going to say the exact same thing.
No.
Not specifically NAMI, but NAMI's great. But this idea, the fancy pants term for it is peer-to-peer healthcare, but what it really means is just people helping each other. And there was a study done that is really a no-brainer, but it's profound if you think about it. And there was 2 questions. If you don't know what's wrong with you, who do you go to for advice? And the vast majority of people said a clinician, of course, the physician or someone. If you're scared, if you don't know what's wrong with you, who do you go? Then the second question was, if you know what's wrong with you and you need help, who do you go to? And it was a friend, a family member. So whatever your passion is regarding healthcare, and whatever organizations support people helping each other, I would support that organization.
Well, It is 8:15 and we need to wrap up tonight, but please join me in thanking these points on the star.